In this month's Overcoming Pain segment, Dr. John Birgiolas answers a few questions submitted by our viewers.
This is Dr. John Birgiolas with Overcoming Pain, and today we're going to be answering some questions submitted through upmatters.com. So our first question comes from Steve, and he asks, I was recently in a pretty rough off-road biking accident. I occasionally experience brief numbness in my toes. Could this be related to potential spine damage? Certainly anytime a patient develops new numbness in their toes, this could be indicative of a new disc herniation in the back. So yes, this could be caused from damage secondary to your biking accident. So the first step is always to be fully evaluated either by myself in this clinic or another provider, and to get some other diagnostic techniques performed such as an X-ray or an MRI. Our next question comes from Chuck. Do you guys do cortisone injections? I have had some issues recently with what I believe to be my sciatic nerve and was thinking about trying an injection. So cortisone is a type of steroid medication which we often use for epidural injections. And if your sciatic nerve is irritated from a disc herniation, for example, we certainly do many injections such as an epidural, but we also use cortisone type medications for other procedures as well. So yes, we certainly perform many injections with this medication. Our third question comes from Levi. What's the most common spinal diagnosis you run into? How is it caused and treated? The most often diagnosis that we see in our clinic is low back pain secondary to arthritis in the facet joints. And these are usually treated with different types of diagnostic injections and then eventually a procedure called a radiofrequency ablation where you can actually add heat to those joints to help stun the nerves, innervating the pain fibers, therefore giving the patient relief upwards of 6 months, if not a year. Our last question comes from Jonathan. I have chronic scoliosis. What are some tips and methods you found to be useful with your patients to help cope with some of the pain? I've met with specialists about this, but it never hurts to gather as many opinions as possible. So the approach to scoliosis is a multimodal one, and so it can essentially involve many different treatments, including physical therapy, aquatherapy, seeing a chiropractor, and you can also supplement this with different medication management such as anti-inflammatory medications and sometimes opioid analgesics. And really at this clinic, we like to perform injections, and so there are different types of interventional approaches which can also help with scoliosis management. Once again, this is Dr. John Birgiolas with Overcoming Pain, and if you ever have any questions about pain management or you'd simply like an evaluation, go ahead and give us a call at 1-888-724-6377, or you can visit us at paindiagnostics.net. And if you have any further questions, go ahead and submit one through upmatters.com.